please.
Yeah, good morning, everyone. Myself, Dr. Navya from Bangalore Medical College and Research Institute. So I'll be presenting a case of brittle cornea syndrome with a blue sclera. So this patient, 53-year-old male patient, he presented, who's a daily wage laborer from Bangalore. He presented with a complaint of trauma to the left eye 4 hours ago, and following which he had diminution of vision. So he gave an history of trauma to left eye with a cardboard box at his workplace around 6 p.m. and he presented to the ER at around 10 p.m. on the same day with a diminution of vision associated with pain and bleeding. There was no history of any ocular trauma or ocular surgeries previously and no systemic comorbidities. Family history, no history of similar complaints in the family members, no history of any consanguineous marriages in the family. His personal history, and in general physical examination, the patient had hard of hearing and there was hyperflexibility of the small joints noted. In systemic examination, everything was normal. So coming to summarizing it, it was a 53-year-old male patient with hearing impairment, hyperflexibility of small joints, who came with a complaint of diminution of vision following a trivial trauma. So coming to the ocular examination, the facial symmetry, head posture was normal. Coming to the vision, right eye had a distant vision of 624 parts, improving to 618, and best corrected visual acuity was given -6 spherical and -1 cylindrical, which came up to 612. Left eye was PL negative eye, and there was mechanical ptosis and lid edema of the left eye. Right eye was normal. Then on examination of the sclera, there was bluish discoloration of the sclera noted in both the eyes. Coming to the corneal examination in the right eye, the size, shape, and the surface was smooth and the transparency was fine, but there was thinning of cornea noted throughout the thickness. Then corneal sensation were intact. In the left eye, there was a full thickness corneal tear from 3 to 10 o'clock hours with expulsive choroidal hemorrhage. Then coming to the anterior chamber, anterior chamber was normal in the right eye, but a flat AC in the left eye. Iris of left eye showed the iris prolapse between 3 to 10 o'clock hours. And lens in the right eye had nuclear sclerosis grade 1 with cortical cataract. And posterior segment examination was normal in the right eye. And this was the photograph of the left eye on presentation. There was a corneal tear with expulsive choroidal hemorrhage. And the right eye showed bluish discoloration of the sclera and the thinning of the cornea throughout. The hyperflexible joints were seen in the thumb, and there was a contracture of the small joints of the little finger. And investigations, routine blood investigations were done, which were all normal. And right eye specular microscopy, central corneal thickness, pentacam, and anterior segment OCT was also done. In right eye anterior segment OCT, it was seen that the thickness was 247 micrometer. And the pentacam of the right eye showed global thinning with a thickness of just 210 micrometer. And the corneal thickness spatial profile showing a flat line, and you can see the total corneal thickness, total corneal thinning. And this is the left eye B scan showing the diffuse dense hemorrhages. So the diagnosis was done as right eye senile mature cataract with nuclear sclerosis grade 1 with cortical cataract with a brittle cornea. And the left eye was a full thickness corneal tear with iris prolapse with expulsive choroidal hemorrhage secondary to the penetrating trauma with a dense vitreous hemorrhage with a brittle cornea. Left eye primary corneal tear repair was done, and post-op moxifloxacin with dexamethasone, carboxymethyl cellulose, and HPMC was given. And oral steroids were started, vitamin C to cover for the dense hemorrhages, and protective glasses was told. Like right eye, optical penetrating keratoplasty was planned, but the patient was not willing for the surgery, so we couldn't do it. This was the post-operative images of the left eye. There's a lot of cheese wiring seen on the inferior surface of the cornea, the suturing as well. And to evaluate for the blue sclera, the family member, the son of the patient was also screened, pentacams were done. So we could see there was thinning, like it was 458 micrometer of thickness was noted, both in right eye and the left eye, but he's kept under observation for now and no intervention as of now.